It's my pleasure today to be able to introduce to you some of our top physicians that we have here at FHN who are working tirelessly to help keep our community safe. To my right is Dr. James Coca, who is a very experienced emergency room physician, and he's also our chief physician executive. So he works very closely with a lot of our clinicians in setting our processes, our protocols, including staying on top of the latest trends and developments so that we can implement them here at FHN. And to my left is the president of our medical staff and also our chief infectious disease physician, Dr. Robert Geller. Dr. Geller is a full professor and has been named a top doctor by Castle and Conley numerous times. And Dr. Geller is on the front lines of making sure that we're up to date using current practices and very well informed as our physician expert. We thought that in this week's video it may be beneficial for all of you to be able to hear from these top physicians. There have been a number of changes at FHN since last week. Some of the changes include extensive training as well as much more preparedness planning. We've all learned a lot and we're taking advantage of that information to see how quickly we can adapt that into our own plans. For example, we have a MABUS tent that's in our parking lot, and that acronym stands for Mutual Aid Box Alarm System. This tent will be utilized not only for testing, which we're doing presently, but also for what we call triaging, and that's a way that we can see a very high number of patients and screen them rapidly for potential treatment or redirection. So several training exercises have occurred, and we've learned in each one on how to make that process more streamlined while protecting both staff and patients in the process. We've also doubled down on our conservation efforts with personal protective equipment that you're hearing a lot about so that we can truly be prepared to protect, again, patients and staff in the outbreak or a lot more volume from COVID-19 patients entering our doors. So much more work is going on right now, and we're getting ready to be better prepared to serve our community. At the hospital, we are not as busy as we usually are and we would like to be. Our volumes are significantly down because we have canceled a lot of our elective procedures and any procedures that aren't urgently or emergently needed so that we're prepared to respond to a potential pandemic outbreak. At the same time, that has adversely affected our ability to keep some of our services open because we're not seeing those volumes and we're not seeing the population that we normally see. I think it's important for the community to know that if you do have an urgent or emergent need, FHN is here for you, and we are still very well prepared to be able to meet that need. We do look forward to being able to reschedule and resume our normal operations and services as soon as we get through this peak of our pandemic. One of the challenges this time of year is that we're still seeing a good number of flu patients or influenza patients, as well as those with other respiratory conditions, which once again, coronavirus is much different than the flu. However, that is impacting our volumes where it comes to respiratory conditions and people that potentially should be in isolation. So our staff is getting a little bit of extra training on those isolation precautions, as well as we've doubled down on all of our cleaning protocols to make sure that our organization is a safe place for everybody. One of the tools that we have available to assist our community is our online symptom tracker. It's free and it's readily available for use, so if somebody is suspicious or not quite sure of what kind of symptoms they're having and could it potentially be coronavirus, I would recommend starting there as using our online tool, which is available at www.fhn.org. We also have a coronavirus hotline where people can call and ask questions, and we'll try and direct them to the best resources possible. If you are not feeling well, I do want to emphasize that FHN is still open for business and ready to serve you. So your provider offices are very safe places, as well as the hospital. And we've taken extra precautions to make sure that if you're not feeling well and you need to see somebody, you can do so in the safest manner. So the best practice is always to call your physician office as well.
Well, it's very difficult given that this is a brand new virus, and what we have done is formed a medical advisory group, and the medical advisory group assists me in gathering all the information we can. We are on a daily basis looking at the guidance given by the Center for Disease Control, the Illinois Health Hospital Association, the message boards that the various specialties get. That we try to look at all, the information that we can Google that we get from the big hotspots like New York City, California, Washington, Italy. We get together, we try to make sense of the information that we're getting, given that it's all new. There is no well-controlled studies about the coronavirus at this time, so we're doing the best we can to bring the information together and make really good judgments. It's getting better every week because we're getting more information. And we are now seeing that there are certain drugs that are working very well and certain techniques that are working very well to control the virus. As a hospital system, we're under guidance from the federal government and the state government to prepare plans for future surges. We have been very lucky in Freeport that we have not seen a huge surge. However, we have to plan for it. We also have to plan for the fact that people might spill over from other areas that we have to take care of. So the hospital has an incident command system, and we're following all the federal guidelines in planning for a potential surge of patients. The main reason is there's really a lack of testing medium. So we have tests, and we have machines to run them, but we don't necessarily have the gel that you would put the swab in to transport it to be tested. And there's also still a lack of testing. So what we need to do is we need to reserve the tests for those individuals that are high risk or will be treated. At this point, that's who we're testing. As testing becomes available, then we would be able to offer it on a wider basis. No, it does not. It means that they have signs and symptoms suggestive of COVID-19, but we need to remember there are 5 known coronaviruses. This is the 5th. So they could have any one of those. They could have the flu. They could have a variety of other illnesses. Because the testing is not widely available, and at this point we're not getting test results back for 8 to 9 days, it really isn't giving us a lot of guidance and the ability to predict and identify those individuals that have it immediately. So the best course that we have is if you have symptoms suggestive of COVID-19, we're asking you to self-quarantine if you don't have a fever, and then you could, after 14 days, you generally don't have the virus. So the interesting thing about this virus is that we know it has at least a 14-day asymptomatic viral shedding period. So what that means is that you can be carrying it, then you can be shedding the virus to all other people that you come in contact with for up to 14 days before you show any signs and symptoms. What makes this particularly dangerous is we all know how the flu spreads very rapidly. The flu has a 3-day asymptomatic viral shedding period. So essentially, the COVID-19 virus has 4 times the exposure to other people before you know you have it than they have it. So that's why it is really so infectious. The short answer is we prefer that not to occur. There's a reason why we're asked to stay home. We don't know everything about the virus, but if it's necessary for business, you need to do some personal issues which are important. It would, again, it's not advisable, but it can be done. What you need to do is make sure you follow the guidelines. Social distancing, no coughing, wash your hands, practice those techniques which we're pushing out to everybody, and try to limit who's coming and going in your facility. It's an interesting subject that, kind of goes to the heart of what this virus is about. So the virus essentially for 80 to 90% of the people is just a cold. In fact, 80% of the people that actually test positive don't even know they have it. But those individuals, it seems, that are older, particularly over 60, but certainly over 70, those individuals that have several types of risk behaviors, immune compromised, renal failure, diabetes, asthma, particularly asthma, they can get very sick because this virus can attack the lungs. And when it attacks the lungs, it creates an intense inflammatory response, which is very difficult to treat. At that point, it's almost not an infectious disease. What people get is their lungs just get so highly inflamed that they're almost unable to breathe. And many of them require intubation or the insertion of a tube into their lungs to help them breathe. This is almost exclusively in high-risk populations. We do see some deaths, of course, they're widely reported, but it's just a de minimis or very small amount of people under the age of 60, unless they're immune compromised, they've had a transplant, those kind of things. So really what we see is bimodal. You have a very, very sick population, then you have 80 to 90% of the people who have essentially a cold. The way the virus works is it enters the body typically through certain types of cells in the lining of the lungs. And we find that in younger people, particularly under the age of 10, they oftentimes test positive for having the virus, but it just doesn't seem to cause them any symptoms. A lot of people that don't know they have it will look back and say, oh, I had a fever and a stuffy nose and a cough. That's the 90%. 90% of the people only get mild symptoms. So to go back, what I said is then, when you take the people that are at risk, this thing seems to migrate to the lungs, and that's when it causes a big problem. When it enters the lungs, then it causes an intense inflammatory response in the lungs. These are the people that end up on ventilators. These are the people that end up dying. However, we have learned a tremendous amount about treatment of this virus in the last really 3 weeks. And at FHN, we've really been on the cutting edge of identifying treatments. And we believe we've had about 3 patients that we have known positive that we've initiated our treatment regimen, and 100% of them have gotten better.
2 things. One, it appears to be much more contagious than flu. And 2, it's much more dangerous, unfortunately, in that more people who get it are getting very sick, and there are a lot more deaths than we saw in flu. Interestingly, the fact that the majority of patients people who are sick or infected feel well, and therefore are easily spread. It's spread by obvious things such as coughing and sneezing. It's also spread by hands. If somebody sneezes and uses their hand for the sneeze and then touches something, a doorknob, the next person who touches the doorknob gets that sneeze. Yes, you can, which of course assumes that the person who touched that package had an infection. If they didn't, it's no problem, but you don't know that. So it's safe to assume that the person might have. And what I generally recommend is to take the material out of the box in a safe manner. For instance, if I have a box delivered at my front door, I will go outside, take the box to the back, open the box, empty the box carefully, and then dispose of the box right there. Usually my wife will take the inside with clean hands, and I'll only touch the box. And then most important, always, always, always wash your hands. If you have soap and water, perfect. If you happen to have Purell or something like that, alcohol, fine. But make sure you wash your hands, because remember, when you're out in the back of your own house, after you've done this box cutting, you're going to go back in your house and you're going to open the back door of your house with your hands. So make sure you wash your hands first. It's very easy to kill the virus if you do what I said. Wash your hands or use bleach or a cleaning material that you can spray or wipe off, and the virus is dead. It seems to be spreading fast for a few reasons. One is nobody seems to have a basic immunity. So person A coughs in person face of B gets the C, D, and E. And so that's the most thing. Nobody has any what's called herd immunity because it seems to be a brand new virus. No one's ever seen it before. Good question, a logical question. The problem is the virus seems to be much more potent, particularly in people over 60 or people with underlying diseases such as diabetes or asthma or lung disease. And therefore, it's irresponsible because it's so dangerous. Measles rarely killed anybody. And in fact, when I was a child, when there was no vaccine, we were encouraged to have these parties to spread the disease because we knew that childhood illnesses were worse in adults than in children. No, there are none right now. Ordinarily, it could take a year to a year and a half to get a vaccine, obviously because of the worldwide concern of this terrible pandemic. People are working as hard as they can to create a vaccine, but as of this moment, there's no vaccine.
I'd like to say thank you to our community and for the outpouring of support that many of you have provided. I'm also very pleased to welcome you and invite you to join FHN in a Say Thank You to Your Community campaign. What we've launched on our social media channels is the ability to take one of the FHN logos with the heart and hands and write on the heart something or someone that you are grateful for and to post that on our Facebook site. If you'd like to download a free template, we have that available at www.fhn.org. Say Thanks to Your Community link. Once again, it means a lot for all of our caregivers to hear the words of encouragement and support throughout our communities, as well as our first responders, people that are working hard to keep our city operating and our county going, as well as all of the delivery drivers, food service workers, and numerous other individuals that we have throughout our community. So from FHN to all of them, thank you. And once again, thank you as a community for supporting your local independent healthcare organization.